New this morning, there's been a lot of confusion surrounding COVID testing as of late. So I spoke with one of UC Health's infectious disease doctors, Dr. Jennifer Forrester. This morning, she gives us some clarification on the two main types of tests and how you can have more confidence in the results of the testing you may get.
There's antigen tests, there's antibody tests, there's PCR tests. The polymerase chain reaction test, or PCR test, is looking for viral nucleic acids, so the DNA or RNA of the virus, depending on which one you're looking at.
This is the most accurate test.
These are the most accurate tests, right? I will say that it is highly dependent on the sample being done well. We have trained our nurses and medical assistants to do a really aggressive swab. So if it doesn't make you cry, then it might not be the best swab.
Fantastic.
Right. It's not pleasant. Anyone who has had it will tell you that. And it relies on how much virus, if you do have COVID, you have at that exact moment in time. If you are kind of starting to feel sick and you get the test and it's negative, but then 2 days later you feel really sick, you could still have COVID. An antigen test looks for a particular part of a virus. In this case, they just tend to have some false positive and false negatives that can be really frustrating, like for the governor, for instance, to people to get maybe a false result. And that's why his was, for instance, was backed up with a PCR test. A little bit more costly. They can take longer to get the result for that, which is why a lot of people do the antigen test first.
And the antigen test for the layperson is the rapid test? Is that what
it is? Yes, exactly. Scientists are out there trying to make those tests better and better and better. And so I do think that eventually we're going to get a very good one of those tests. But right now they are laden with false positive and false negative rates, and should always be backed up with a PCR test, just like Governor DeWine had.
Dr. Forrester says the best approach to determining whether someone has COVID is to look at the patient's whole story. What are their symptoms? Were they exposed, and how? And then what was the test result?